Have you ever noticed a blue or bluish-black mole and wondered what it is? Could it be something serious? Today we're diving into the mystery of blue naevi, a special type of mole that looks quite different from the usual brown ones. Hi, I'm Dr Finbar. I'm a GP with a special interest in dermatology and skin cancer, and I'm here to help you understand these fascinating little spots on your skin. I'll be sharing lots of examples of blue naevi in the video, along with the dermoscopy, and that's what they look up close with our dermoscope light. Let's go back a bit. What is a naevus? Well, the word naevus, sometimes spelt like this, comes from the Latin meaning birthmark or spot. In medical terms, a naevus usually means a mole or a cluster of pigment producing cells called melanocytes. So here's a quick science lesson, but don't worry, I'll keep it simple. The little bit at the end of the word cyte means cell. Melanocyte is a pigment producing cell. So melanocytic means having more melanocytes than usual, and that's exactly what a mole is. These melanocytes produce a pigment called melanin. That's a natural substance that gives colour to our skin, our hair and our eyes. This pigment is what makes moles look brown or black or blue in this case. Blue naevi are relatively uncommon, but they're not rare. They can appear in people of all ages, but they often develop in childhood or early adulthood. Both men and women can get them with no strong preference. You'll often find blue naevi on the hands, the feet and the scalp, and sometimes on the trunk or arms. They usually appear as small, smooth, blue or bluey grey spots, and most people only have one or two if they have any at all. Now, while these moles look blue instead of black or the usual brown, now remember, a naevus is just a cluster of melanocytes, those pigment producing cells. Normal moles usually look brown or black because the melanocytes sit close to the skin's surface, particularly around the dermo-epidermal junction near the top. The pigment produced here is near enough to the surface, and that means that the light is reflected back to our eyes as brown or black. Blue naevi are a bit different because their melanocytes live much deeper down in the dermis. This is a thick middle layer of the skin. So this deeper location changes how the light interacts with the mole. Now, for many years, doctors believed that the blue colour was due to something called the Tyndall effect, meaning that blue light, which has a shorter wavelength, scatters when it hits those deep pigmented cells, making the mole look blue. But there's new research now in this, and they suggest a slightly different explanation. And it might be that blue naevi scatter less red light, which has a longer wavelength, and that makes the blue or grey colour more obvious. Think of it like mixing paint. If you remove the red paint, the colour shifts towards blue. So blue naevi look blue because of how light scatters and is absorbed by the pigment located deep down in the skin, while normal moles are brown or black because their pigment is up close to the surface. Blue naevi are benign in themselves and they're usually harmless, meaning that they don't cause any problems and aren't a cancer. But sometimes a mole that looks blue or dark could be a melanoma, and that's a serious form of skin cancer. Now, it's important to watch for signs like rapid growth, changes in colour or shape, irregular borders, or if the mole starts to bleed or become sore. If you notice any of those changes, please see a healthcare professional who can examine your skin carefully using a dermoscope, and they are trained in skin lesion recognition. Why do we sometimes leave blue naevi alone and sometimes we biopsy them? Well, most blue naevi don't need any treatment and can be safely left alone if they haven't changed for years. So it's important to know that the moles you have, where they are and what they look like, so that when you go for a skin check, we can ask you, how long have you had that blue mole? And then everyone's reassured if you can tell us it's been there for many years. That's a really reassuring feature of them. However, if a blue mole changes in any way or looks unusual, we might recommend a biopsy, and that means removing a piece of the mole or all of it altogether and examining it under the microscope. And this is the best way to be certain that it's not a cancer. Now, this is a careful approach, helps keep you safe while avoiding unnecessary procedures. Here's an example of a blue naevus that I thought was too unusual compared with other blue naevi, so I excised it. Now, thankfully, it did come back from the lab as a benign blue naevus. So blue naevi are a special type of mole with pigment deep in the skin that gives them their unique blue-grey colour. They're usually harmless but can sometimes look like a melanoma, so it's important to keep an eye on any changes. If you have a new or changing mole, or you're unsure about one, do get it checked. Early diagnosis helps keep your skin healthy and your whole body too. I hope you found this video useful. Please like it and subscribe if you did. I'll be sharing more videos about skin health so that you can learn to love the skin you're in. Bye for now.